Again, today I'm not dealing with book knowledge. Today I'm dealing with day-to-day life problems as a doctor. That was my purpose of this session. Otherwise, book knowledge, you have so many platforms to teach you, right? So tell me something. When a person came to you with a viral infection like COVID, if you ever saw blood reports properly, COVID is a virus, right? So their lymphocytes were elevated. Okay, next, if I ask you, any other viral infection, nowadays so many viral infections, and how in our country people come to you, they will say, I had fever. Okay, you'll say, oh, did you think it was bacteria? He'll say, I don't know all this bacteria and all. I think that I had fever, so I went to a local pharmacy, I went to a chemist, and he gave me antibiotics. I kept eating antibiotics because I thought it was bacteria, but my fever did not subside. Because why would it subside? Your fever was not because of bacteria. So why will it respond to an antibiotic? Your fever was actually a viral infection. Viral infection obviously will not respond to an antibiotic. So now you understand why getting these kind of tests are important. So now just imagine, if you see someone's neutrophils are elevated, it's a bacterial infection. If you see someone's lymphocytes are elevated, you can tell him that, listen, I think it is a viral infection. You don't need to take antibiotics unnecessarily, because all of you, we are not just reading path, we are reading microbiology, we are reading medicine. Don't you know unnecessarily taking antibiotics is not at all good? Unnecessarily you are creating resistance of the bacteria. So no usage of antibiotics without any evidence that why you have to use antibiotics. Okay, so these are done. But again, I told you, never let, so what is the next cell that I'm going to teach you? Never let monkeys. So M is going to be for monocyte. Here you come, another season which is going to come very soon, and very good. Monocytes, how to identify monocytes? You can all visualize the nucleus. Nothing for me to teach you, it's so evident in front of you. The nucleus is the shape of a kidney or a reniform, or it's looking like a bean, baked beans that you eat. So like a kidney, that's a monocyte. Now you'll ask me, when is monocyte increased? Very simple way of learning. Monocyte is gonna be increased in an infection that is malaria. M for malaria, M for monocyte. So happy that many of you know it. That's amazing. I can see the chat where malaria is full. So great, guys. So now you know. I'll tell you, you'll say, ma'am, how does it matter only? Malaria is something, do you diagnose? Do you say, oh, you have monocytes, this means you have malaria? No. How is malaria diagnosed? Malaria is diagnosed when you see what? You'll say, ma'am, when I see the entire parasite, I see Plasmodium vivax, I see Plasmodium falciparum. So practical rule number 1 that I'm telling you is, till the time you don't see Plasmodium, you don't give the diagnosis of malaria. Means I will have to see Plasmodium under the microscope. I will have to see Plasmodium under falciparum under microscope. So then what is the purpose of this monocyte? Again, I'll tell you a practical thing. Today morning I went to the lab. Early morning I had to go. And malaria cases have started coming up, because not too much, but yeah, the season will gradually build up as summers and rainy season comes. So on a usual rainy day, what happens in my life, I will explain that to you. On a usual rainy season, when I know that, oh, every second person is having malaria because of female Anopheles mosquito, then at that time I go to the lab and I see, oh, today there are 500 blood samples that have come from all over the state, and 500 clinicians are calling me, does my patient have malaria? Does my patient have malaria? We have to start anti-malarials. And I'm like, okay, 500 samples are in front of me. I am a human being. How will I look at 500 blood samples for malaria in 1 hour or 2 hours? Impossible, right? I will take 1 day to 2 days as a single human being. So how will I gather? What will I do? I will give these 500 blood samples to the machine. Machine can work faster than me. What will machine do? Machine will tell me all those samples where monocytes are high. So out of 500 samples, I will find there are 20 samples where monocytes are coming high. So I know whose slide do I have to see first. I have to see these 20 slides or 20 samples first, because these are the people who probably have malaria. The rest of the 480 I will see after that. I hope that is okay with this. Yes, everyone got it? Okay, so now we come to, okay, someone said expression of CD16. Oh, these are big things. Today we are not discussing CD markers, because when someone has to get a CD marker testing, that costs thousands of rupees. It's a very expensive test. Even in foreign countries, it's expensive. It's not something. I'll tell you a simple analysis, because we are only talking practical today. A simple complete blood count is gonna probably cost 1/100th of a CD marker testing. And first thing is, you have to give the patient an economical kind of an option. Otherwise, he's never going to return to you. He's saying that this doctor only gives me expensive tests which are written in the textbook. First, you will have to start with something very basic, something that costs him less than 100 rupees. He will be happy with you. Otherwise, you know how people keep blaming us. They believe that we are only there to take money out of their pocket, right? That kind of blames always doctors get. So we can't give them expensive tests. So first we start with simple test. Now tell me guys, never let monkeys. One more thing, every monocyte is not a malaria. That is not that, you can't take that home message every time you see monocyte, you force the patient is saying, I don't have any symptoms only, I don't have fever, I don't have chills, how are you saying I have malaria? So is there any other, which I could see a couple of you writing in the comments, is there any other situation in which monocytes increases? It's a very rare thing, but yes, there is something called JMML. For those who don't know, I'll let you know the full form. JMML means J for juvenile, so this will be seen in those 6-7-year-old kids. Okay, myelomonocytic leukemia. Can you see what is increased? Myelomonocytic leukemia. So firstly, leukemia, you're like, I know what a leukemia is. It's a blood cancer. And juvenile, I know, means it's a chota bacha. It's a small kid. And he's having a leukemia. What is that leukemia going to show me? Lots of monocytes, right? So that is also going to result in increase in monocytes. Dr. Adnan, you are right. Ma'am, this is only in small kids, 5, 6, 7-year-old kids. What if my patient is 50 years old, 60 years old, 70 years old? Then instead of juvenile, I can't use juvenile word for a 50-year-old. I will use the word CMML, chronic myelomonocytic leukemia. So just in case my patient is a little old, then my terminology becomes chronic myelomonocytic leukemia. Everyone's okay with monocyte story? Okay, never let monkeys eat bananas. I'll come to this in a while. This is a totally separate thing. Never let monkeys eat bananas. So E for eosinophils, the easiest cell to identify. Why? Have I taught you any cell which is orange looking? Orange looking. Okay, someone has just put up a doubt. Ma'am, please revise monocytes in short. Yes, a single sentence of take home message. There are 3 questions you have to tell me. Everyone, revision for everyone. Monocytes, what is the shape of the nucleus? It is a kidney or a reniform shape. Second, which is the infection in which monocytes will be increased? It is M for M, that is malaria. And which are the leukemias in which monocyte will be increased? If it's a chota bacha, if it's a kid, it is JMML. And if it's an older person, then it is CMML. Amazing. Those are 3 questions on monocytes and we are done. Eosinophil, my favorite, everyone's favorite, because this is the only orange looking cell. Can you all visualize this? The color is totally different. I have not shown you anywhere in pathology or hematology an orange looking cell. That is an eosinophil. And look at the nucleus. Yes, I can see this nucleus is, everyone has their imagination. Some people say, oh, this nucleus looks like a spectacle. Some people say, no, I think this nucleus looks like headphones. So your imagination. Basically, there are 2 lobes. You think it looks like a headphone, you think it looks like a spectacle, your wish, whatever you want to call it. Okay, when it increases, what does it signify to the patient? Amazing, guys, you know it. Either the patient has allergies or the patient has parasitic infections. I'll give you a practical point over here also. See, whenever the season changes, like from winter, when we are going into, say, from February to March, this season that I'm talking about right now, this is the time, or any season change depending of course on the country. Whenever season changes, you will suddenly realize that all the hospital blood samples are showing increase in eosinophils. Does that mean the patient has some infection? No, you think season point of view also, that why are suddenly 100 patients showing me increase in eosinophils? Season change has happened. Season change means people are allergic to so many things. Some people are allergic to the onset of spring or fall or maybe winter. So season change or allergies is something that increases eosinophils. One more thing. many people are asthmatic, right? So asthma is also a type of allergy only, correct? So maybe the person says that I have had asthma since 10 years, but in this last 1 month I'm having too many bouts of asthma, so that is why my eosinophils are high. Some kind of allergy or any kind of parasite. A 5-10-year-old boy has hookworm infection, hookworm, roundworm, any parasitic infection, your eosinophils increase. Coming to, remember the mnemonic, never let monkeys eat bananas. What is this B for? B for basophil. B for basophil, and B for what? How does it look like? Basophil looks blue black. Repeating, basophil is gonna look blue and black. So look at this cell, guys. I can hardly see anything. In this cell, all that I can see is there are big granules. There are big granules that are there. That is blue black granules. Now the most important thing, basophil. If you like, today you go for your blood sample, you will say, ma'am, you told me never let monkeys eat bananas. Basophils were supposed to be maximum or least in my blood I will find basophil, hardly one. Sometimes you don't get to see, zero basophils hota hai. Okay, so when and which patient will show you increase in basophils? Very good, I can see people answering, everyone's answering CML. There are many diseases, yes, very good, even polycythemia vera, but CML you cannot miss out, because as soon as I start seeing 5, 6, 7 basophils, I'm like, okay, hang on, this is not a simple normal blood sample. Does this patient have either CML, leukemia, blood cancer, very dangerous, or this patient has polycythemia vera? I am not done. I have done the basic identification. You guys still don't know the normal values, which is the next slide. But before that, I have a test for you. Can you tell me what is cell number A, cell labeled as A over here? It's not a test. I wouldn't call it a test, but I would call it a revision.